Good morning, how are you doing?
I'm good. How are you?
I'm doing great, thank you so much for asking. My name is Charmaine Kidd, and I will be performing a head-to-toe assessment on you, okay?
Okay.
If you don't mind, could you please state your first and last name and your birth date?
Phyllis Lowe. My birthday is 4/1959.
Okay, thank you so much for that information. Now we've already gotten some of your vitals. We've gotten your blood pressure, which was 125/80. Your temperature was 98.6. Your height is 4'11". Your weight was 140, and your body mass index is going to be 29. Now I'm going to check your respirations, and I'm also going to check your radial pulse. So we'll require some touching, okay?
Okay.
So just relax for me. Okay, it shouldn't be too much longer.
Okay.
So your radial pulse is going to be 64. Okay?
Okay.
So just relax for me and just breathe normal. Okay, your respirations were 20, which is normal, as well as your radial pulse. The next thing we're going to do is we're going to do your eyes. So we are going to actually look at your conjunctiva. So if you don't mind, could you remove your glasses for me, please?
Okay.
Thank you so much, and I can set this down for you. Okay. Then I'm going to touch your face. Your conjunctiva is clear. The next thing I'm going to do is I'm going to use my pen light to flash my light in to look at your corneal. And I'm going to be testing your corneal reflex, okay?
Okay.
So just look straight ahead for me. Be a bright light. Let me try that again. There we go. Sorry about the bright light. So your pupils are equal, round, reactive to light and accommodation. The next thing we're going to do is test your visual field by confrontation. So basically you're going to cover one eye at a time, and you're just going to follow my pen light and say yes when you see it.
Okay.
I'm going to let you use my note card to cover your one eye. I'm going to cover my opposite eye.
Yes. Yes. Yes.
Okay, and switch.
Yes. Yes. Yes.
Okay, good. And that was testing for your peripheral vision. So your peripheral vision is good. The next thing we're going to do is the 6 cardinal fields of glaze. So you're just going to follow my pen light again. You don't have to cover your eyes this time, okay?
Okay.
And that was to check for nystagmus. You do not have any nystagmus. Normally we would see your eyes moving when it's in one position, so that's good. The next thing we're going to do is check your distant vision. So you can either remain seating or you can stand up if you would like. And I'm going to hand you your glasses. Place this back on.
Thank you. Okay.
Alright, so read for me from left to right, from the top to the bottom. Okay? And you're going to cover one eye first.
Okay. E F P T O Z P D C L P E D P E C F D E D F C Z T F E L O P Z D D E F P O T E C L E FOPCT, FDPLTCEO,
Okay.
POZ.
Okay, you can stop right there.
Okay.
And switch eyes for me.
EFPTOZ, PDC, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC, LEFODPCT, PDELTCZO.
Okay, you can stop right there for me. And you can read with both your eyes now.
Again, readjust it here.
Okay.
EFPTOZ, PDC, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC, LEFODPCT,
Okay.
FDPLTCEO.
Okay, so with your glasses, you do have 20/20 vision. So I'm going to ask you to take your glasses off. Thank you. And then let's try this again without your glasses. And cover one eye first.
EFPTOZ, PDC, LPED, PECFD, EDFCZP, FELDPZD.
Okay, you stop right there for me and switch eyes.
EFPTOZ, PDC, LPED, PECFD, EDFGZP, PELOPZD.
Okay, you can stop right there for me and read with both eyes.
Okay, let me get my eyes adjusted here again. EFPTOZ, PDC, LPED, PECFD, EDFCZP, FELOPZD, DEFPOTEC.
You can stop right there for me. So with your glasses off, your vision is going to be 20/25. Okay? And next we're going to do is check your peripheral vision. Let me flash this back. Excuse me, your near vision, not your peripheral vision. So just read with your glasses on, please.
Need to cover?
No, you don't need to cover.
Okay. EOPZTLCD, F, TDPCFZOEL, DZELCFOTP, FEPCTLOZD, PTLFCZDEO, ELZTCOFPD, DZECLPTOP.
Sorry there. So your near vision is going to be 14/14. That's good. Correct the lenses on. So the next thing that we're going to do is your skin assessment. So that will require me touching your skin, okay?
Okay.
So let me know if you feel any discomfort or any pain, okay?
Okay.
Touch the pad. Okay, sorry, my hands are cold. Apologize. Okay. So your skin is smooth. Any bruises or lesions that you're aware of?
No.
Okay. Touch your legs. So your skin is far as temperature wise, and your arms and your legs are even bilaterally, so they're both warm. Your skin is smooth, it's brown, and any pain or discomfort when I touch? Okay, so there's no primary or secondary lesions that I have seen on your skin. The next thing that I'm going to do is look at your hair, okay? So, lean forward for me just a little bit. So your hair color is brown, a dark brown. There's no lesions that I see. Your hair is coarse. Does it hurt anywhere when I touch your scalp?
No.
Okay, hair is clean, and it's evenly distributed bilaterally, or over the head, I should say. Okay, so the next thing I'm going to do is check to see if your skin is elastic, and it is elastic, so that's good. I'm also going to check for edema. Basically, that'd be any unusual swelling or if you're holding water in certain areas. So no edema in your hands. Check your tibia. Okay, so there's no edema in your tibia. I'm going to check your feet. No edema. I'm going to check your ankles. So you have no edema bilaterally in your hands, your tibia, and on your feet and ankles. And the next thing we're going to do is your nails, okay? So I'm just going to see your hands. So your nails are clean. You know that's smooth. Your cuticles are smooth. You know that's flat. I like to take your index fingers, put them together for me. Okay, so there's no clubbing noted, which is good. Okay.
Okay.
And your capillary refill is brisk, which means that's less than 2 seconds. You want your capillary refill to be 3 seconds or less, so that's good. So the next thing we're going to do is your head assessment. So I'm going to be touching your head, holding it and pushing on it. So let me know if it hurts at all when I touch.
No.
Okay. Anything here?
No.
Good. So your head is normal size for your body. Your eyes are symmetrical. Your nose is symmetrical. Your lips are also symmetrical as well. It's really good.
Okay.
Okay. Okay, so next thing I'm going to do is feel on your temporal artery, which is on the side of your head. It's right here.
Can you take my glasses off?
Yes, please. Thank you. Okay, so your temporal artery is smooth. It's good. Bilaterally. I'm going to listen to your temporal artery with the bell, which is this portion, to ensure that you don't have any worries. Normally I say soft blowing that I can hear, okay?
Okay.
Just relax. Okay. Sorry about that. Okay, so there are no worries noted. That's great. The next thing we're going to do is we're going to test for TMJ, basically the range of motion in your jaw, making sure there's nothing unusual. So if there's any pain with movement, let me know. And touch right here in front of your ears. So open your mouth slowly and close it for me. And again. Good. So I didn't hear any clicking. Was it any pain when you were moving your jaw?
No.
Okay, good. Did it hurt when I touched?
No.
Okay, and you are able to move your jaw without any limitations of movement. So the next thing I'm going to do is check your neck out. Make sure everything looks good. So your skin tone is even. Your trachea is midline, which is really good. Okay. Now we're going to check the range of motion of your neck. So what I'd like you to do is turn your head to the left, to the right for me, and your left ear to your left shoulder without shrugging. Okay, let's try that again without shrugging. Okay, and to the opposite side, please. Good, and extend your neck back. So there is no limitation with movement, which is really good. Any pain when you move?
No.
No? Okay, great. So the next thing we're going to do is observe your jugular vein as well as your carotid artery. Okay, so just relax. And just checking for the pulsation. Okay, we'll check your other side. Okay, good. I'm just going to feel. And I'm going to check your carotid arteries, which will be right between the tracheal and your sternal-mastoid muscle. Right here. And check the other side. So your rate bilaterally for your carotid arteries is regular. It's 60 beats per minute, okay? And there's no bulging on the side of your carotid arteries at all. And also it's regular, so it's normal. It's going to be 2 for the amplitude, and they're strong pulses, so that's really good. The next thing that I'm going to do is check your trachea. So I'm going to palpate your sternal notch, which is here. And go down. Any pain when I touch?
No.
Okay. Run my fingers across. Again, it is midline. Okay. Alright. Now what I'm going to do is I'm going to get you a glass of water because I need to actually get some water so I can look at your thyroid, okay?
Okay.
Alright. Water. Okay. I just washed my hands, so my hands are clean. Okay. Okay, so go ahead and swallow a cup of water for me. Okay, so I am able to see you're swallowing with ease. Is everything okay when you swallow? Any pain, discomfort?
No pain.
No pain or discomfort. Okay. So the next thing I'm going to do is palpate your thyroid. So I'll take that glass of water. Here. So tilt your head down and look to the right slightly for me. Look to the right just a little bit. Okay, and here's a cup of water again that I've located everything.
I need to drink some water.
Yes, please. And swallow for me. Again. Okay, and turn your head to the other side for me. And swallow again. Okay, so normally your thyroid, you're not able to feel it when you swallow, or I should not be able to feel it, and I cannot, which is great. So the next thing I'm going to do is listen for any type of bruise in your thyroid gland as well. Okay, so there are no bruises noted bilaterally. That's great. The next thing I'm going to do is check your lymph nodes. So basically, touching your face, I'm going to ensure that everything is non-palpable and doesn't hurt, okay?
Okay.
Let me touch your face. So this is your periocular lymph node. Any pain when I touch?
No.
Okay, so it's smooth, not able to feel anything. That's great, there's no pain. Next thing I'm testing is the postocular, which is right behind it. It goes here. Any pain?
No.
Okay, so it's smooth bilaterally. And the next thing we're going to do is check your optical. Just going to go a little bit lower. Okay, it's smooth bilaterally. And then we're going to go to your retropharyngeal. Just smooth bilaterally. And your submandibular. Just smooth. Any pain?
No.
Okay, and your submental is here. Any pain when I touch there?
No.
Okay, so your superficial deep chain is here. Any pain?
No.
And then your deep cervical chain would be right behind here. Any pain?
No.
Okay. And shrug your shoulders for me. Any pain?
No.
Okay, so bilaterally on each side with all your lymph nodes, they're smooth, non-palpable, so that is going to be called lymphadenopathy. That means we're not able to feel it and there's no pain. That's great. So the next thing I'm going to do is check your ears. Okay, so I'm going to see if they're symmetrical. They are symmetrical. Any pain when I touch?
No.
Okay. Any pain when I touch your targets? Which
No.
is here. Earlobes.
No.
Okay, I do see that you have piercings on both sides, so piercings bilaterally. Now I'm going to look in your ear. Good, ears are clean. Let's go to the other side. Good. Do you have any past history of any ear infections at all?
I only have problems with my sinus drain. That's the only problem.
Your sinus strings? Okay. So next thing I'm going to do is inspect your nose, which is midline. Know the formulas are noted. And then I'm going to touch your nose. Let me know if you feel any pain.
No.
Okay, good. So I'm looking at your nose. Okay, so cover one side. Breathe in and out. And the other side. Okay, so both noses are patent, which is great. Any trouble when you breathe in out your nose?
No.
No? Okay, great. And I see there was no drainage, no lesions at all in your nose, and everything was intact. Okay, so we've already done that. So the next thing we're going to do is we've already palpate for tenderness, so we've already discussed there's no tendencies at all. And I'm going to test your sinuses, okay? Any pain when I touch here?
No.
And what about here? Your maxillary?
No.
Okay, great. Now next thing I'm going to do is look in your mouth. Clench your teeth for me and smile. Your teeth are clean, no debris. It's great. Make sure gums are pink. No lesions. Say ah for me. No lesions noted. And stick your tongue out for me. Okay, great. All teeth are present, which is good. Teeth are clean, gums look normal. Your throat, look at your throat again. Say ah. Okay, great. So there's no inflammation or swelling noted in your throat. So next thing is the breast assessment. Now, as women, we know that breast cancer is something that is common, so it's always great for us to do a monthly breast self-exam, okay?
Okay.
So when you do it, I'm just going to demonstrate, and then I would like you to do the return demonstration, okay?
Okay.
So you raise one arm, you go around in a circle, and you move that stethoscope. your finger pads. You go round your nipple and out. Okay?
Okay.
Raise the other one. 3 finger pads. Round and out. Okay?
Okay.
Then you also check your nipples for discharge every month. It needs to be the same day of each month, okay?
Okay.
And if there are any abnormalities, you need to follow up with your doctor, okay?
Okay.
Now let's see here. The next thing I'm going to do is test your lungs. So I want you to breathe in for me. And out. So your chest does rise and fall symmetrically. Any recent colds or
No.
nothing? Okay. Just going to palpate your chest. And breathe in and out for me again. Okay, good. So now I'm going to listen to your lungs. Breathe in and out through your mouth. Again. 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 Breathe in. Okay. Okay, let me do that one more time. Breathe in out. Breathe in out. Breathe in out. Okay, and can you scoot forward for me, please? Thank you. Okay, breathe in and out. Again. Again. Okay, so your lungs are clear. Anterior, posterior, and lateral, and it's bilateral. Okay? Next thing we're going to do is the heart and vascular portion. So basically I'm going to palpate, which is touch your landmarks on your chest. Okay? So this here is the right sternal border. And then it's going to be 2 intercostal spaces down. That's 1, 2. This is your aortic. And the opposite side, the left sternal border, second intercostal space, is going to be your pulmonic. And then the third intercostal space would be your earth point, which would be here. And then the fourth point, the fourth intercostal space, which should be here, which is the tricuspid point, or landmark. And then mitral is going to be left clavicle, and it's going to be right here. Alright, so next thing I'm going to do is listen to your heart. I'll be listening for several cycles, okay?
Okay.
Okay, so everything sounds normal. The next thing I'm going to do is check for breweries. I'm going to use the bell portion. I'm also checking for any murmurs as well. And this is the Eric's point. That's where I'll be able to hear any murmurs, okay?
Okay.
Okay, so there's no breweries heard or noted, and you don't have any heart murmurs, which that's great. Next thing I'm going to do is check for carotid breweries. So I'm going to be listening to your carotid arteries again. Okay.
Okay.
So just head straight for me. So there's no breweries noted bilaterally. And I'm going to check your apical pulse as well. So that's going to be the fifth intercostal space, and it's going to be mid-clavicular. I'm going to test it for a full minute, okay?
Okay.
typical pulse is 90 beats per minute. Okay. And we've already checked for edema. Check your hands for edema, the tibia, your feet, and your ankles. And we already stated that you do not have any edema bilaterally in all areas. We already tested your capillary refill. We already determined that that is 2 seconds, which is brisk. Next I'm going to do are your peripheral pulses. So we've already gotten in your, well, I need to get your carotid pulses. I just listened, so let me go ahead and do that. Basically I'm going to be comparing them to both sides, okay?
Okay.